Well, welcome to this final session for the day that entitled Health Cost of Climate Change. So this afternoon, you've heard a lot from the participants, the speakers, and in response to many of the very thoughtful questions, as well as hearing from frontline students and researchers, as well as community members and so forth. But all of this really boils down to trying to gain a better understanding of the healthcare costs, the impact, the magnitude of that on our societies, and perhaps what we can do about that, which we'll hear about more tomorrow. This afternoon, we're really pleased to be able to introduce you to Vijay Limaye. He is a climate and health scientist at the National Resources Defense Council Science Center in New York, but he's stationed in Madison, Wisconsin. Vijay received his Bachelor of Science degree from the University of California in Berkeley, and then went on to get a PhD at the University of Wisconsin. And this PhD was in environmental epidemiology. He then joined the U.S. Environmental Protection Agency as a scientist, focusing on the Clean Air Act, regulatory implementation, air quality monitoring, risk communication, and citizen science. From there, he moved on to the National Resources Defense Council, where he is a climate and health scientist and has published several research studies on the health impacts of climate change, triggered air pollution, and extreme heat in the US and in India. He's broadly interested in addressing environmental health challenges and quantifying and communicating these risks with a focus on the public health burdens of air pollution and extreme heat. So we're really delighted to invite him to provide his perspectives on the health costs of climate change. And I wanted to say, Vijay, we're so excited about hearing your message and really learning from you about the health costs of climate change. Welcome.
Thank you, Kim. And thank you, everybody. Thank you, Clean Air Carolina. It's really a pleasure to be joining you all today. I've been able to listen to a lot of the sessions and really appreciate the invitation to join you all today. So as Kim mentioned, my talk is going to focus on kind of the economic angle when it comes to climate and health. I've got about 15 minutes or so of slides, and then hope to leave plenty of time for Q&A after that. So with that, I'll get rolling on the slides here. Let's see. All right. So I want to just open with a little bit of scene setting here. And I pulled a quote from 2018's fourth National Climate Assessment. For those of you who aren't familiar with it, the NCA, the National Climate Assessment, is a huge effort by the US federal government. Every 5 years, as mandated by law, agencies come together to basically summarize the state of the scientific evidence when it comes to climate change. The most recent assessment really made a splash because it highlighted the gigantic economic risks that the climate crisis poses for the United States. So the impacts and costs of climate change, though, are not some distant future threat. They're actually already being felt across the US. And that issue is increasingly, I think, resonating with members of the public. It's no longer really a feasible, realistic position to deny that the climate is changing in unprecedented ways in terms of the human experience, and that these impacts are extraordinarily costly in terms of lives and livelihoods. I was heartened to see the new administration really zero in on this angle because I think it's an effective hook for bringing in new advocates when it comes to the climate fight. So I'm just going to show this brief clip, which was climate envoy John Kerry speaking before reporters in the opening weeks of the Biden administration, discussing the need to understand that in many ways we are already paying for the costs of climate change.
It costs a lot more. There are countless economic analyses now that show that it is now cheaper to deal with the crisis of climate than it is to ignore it. We spent $265 billion 2 years ago on three storms: Irma, Harvey, and Maria. Maria destroyed Puerto Rico. Harvey dropped more water on Houston in 5 days than goes over Niagara Falls in a year. And Irma had the first recorded winds at 185 miles an hour for 24 sustained hours. That last year, with one storm, $55 billion. So we're spending the money, folks. We're just not doing it smart. We're not doing it in the way that would actually sustain us for the long term.
So I think that was, helpful framing from the very top of our federal government in terms of explaining that, when we hear from certain corners that climate action will be too costly or that we'll have to give up too much, the other side of the argument is not always apparent. In the presidential debates, we don't hear much about how much we're already paying to respond to climate damages in terms of damage to property, crops, infrastructure, some of those damages you heard from Stephanie in the prior session.
It costs a lot more.
Oops. Let me get to the next slide. You've heard that clip already. All right. I think you've heard a little bit about the billion-dollar disaster list, and I just want to add a little bit of context to that effort. For those of you who aren't aware, the National Oceanic and Atmospheric Administration, NOAA, the folks who run the Weather Service, have actually been tracking the impacts of the costliest climate and weather disasters across the country since 1980. So this is a map depicting just those events from 2020 that exceeded $1 billion in damage to property, crops, and infrastructure. I think you've already heard, but I'll just say it again, that last year set a new annual record in terms of the total number of these billion-dollar weather and climate disasters. The previous record was 16 events. Last year, there were 22. Last year was also the 6th consecutive year in which there were 10 or more of these billion-dollar climate and weather disasters. And when you look back in time, not just at 2020, but you go all the way back to 1980, all of the trends are heading in the wrong direction, whether it's the number of events or the total costs of these, only these priciest events. We're seeing that really no corner of our country is spared from climate and climate risks. And we really do need to understand that now is a real key pivot point when it comes to trying to rapidly, reduce our reliance on fossil fuels and prepare communities for climate harms. So you've heard a lot of dollar figures thrown about. Envoy Kerry was talking about the billions of dollars that we're paying to respond to storms. Last year's $22 billion disaster events totaled about $95 billion in damage by the federal government, NOAA's estimate. But that really begs the question, what's missing from these price estimates, right? I mentioned that NOAA is tracking damage to things that are insured or repaired, like roads and bridges and homes. It's much more difficult to track and count and add up all of the pricey impacts of climate change on human health when it comes to deaths triggered by extraordinary climate events like the historic wildfire seasons in recent years out west, or whether it's in terms of really costly medical care. You've heard about outpatient care in the last session. The climate crisis is triggering thousands upon thousands, hundreds of thousands of visits to the hospital, to the emergency room. And it's really difficult to sort of wrap our arms around all of those costs right now. There's no coordinated effort at the federal level, at the Centers for Disease Control, or with the agency that I used to work at, the Environmental Protection Agency. Right now, no one's really tracking how much climate change is costing in terms of our health. And so that's why we at the Natural Resources Defense Council, NRDC, embarked on a research project about 3 years ago to try to better estimate the costs of climate events on our health. So I'll just highlight our research study here. It's an open access, peer-reviewed scientific analysis that appeared in the journal GeoHealth. So anyone can access it for free, and I'm happy to circulate the paper after this talk. Basically, what we did in this research was select from a range of present-day climate sensitive case study events. Think of these as examples of the types of climate harms that we expect to worsen in the years to come. Everything from wildfires and extreme heat to ozone air pollution, allergenic pollen in North Carolina, harmful algal blooms, extreme storms, you name it. We really tried to capture the range of climate sensitive events, all of the things that are expected to worsen in one way or another in frequency, intensity, duration, geographic extent in the future if we fail to step up and act on climate. We selected events from a single recent year in 2012 and basically gathered all of the publicly available data, health data, connected that health data to economic data collected by the federal government to basically estimate what the health costs were of all these climate sensitive events. They'll make headlines in the newspaper, but we often, especially in the summer and fall, sort of are faced with this onslaught, this march of climate and weather disasters, and it's hard to keep track of what's happening across the country and how much this is truly costing individuals, families, communities, and our governments. We employed what's called a combined valuation method. You can think of that as basically capturing both morbidity and mortality, illness and death tied to climate sensitive events. That's important because a lot of climate research focuses, rightly, on premature deaths that are triggered by these harmful exposures. But there's much less understanding out there in the scientific world in terms of what the climate crisis means for illness and treatment of illness in hospitals and emergency rooms. So I mentioned 2012 in our sort of case study set, and this animation basically depicts the whole sort of set of case studies that I spent about 1.5 years stitching together. So everything on this map represents what we're calling climate sensitive events. These are events that are tied through, established scientific evidence to the climate crisis. We have seen that the 2016 Climate and Health Assessment from the federal government and the 2018 National Climate Assessment all point out that each of these risks is expected to worsen into the future. But states are already coping with them right now, and that's certainly the case in North Carolina. We basically collected publicly available health information from state and local health departments, and here I want to thank the North Carolina Health Department folks and Lauren's team. It's been fantastic to see the state of data collection in that state when it comes to extreme heat especially, but also the comprehensive analysis of climate risks happening in that state. So we looked across the country collecting all the information on health to understand what the actual cost burden was. And I'll point out here that 2012, that seems like a long time ago, but it does take time right now for the scientific literature to catch up, right? We had studies published just in 2018, 2019 on the impacts of Hurricane Sandy in 2012. So right now, we're really not in a place where we can rapidly assess the health effects of climate change in this country. We're just not comprehensively tracking it. And CDC is certainly occupied with a pandemic response now. But we're encouraging federal agencies to keep their eye on improving data collection when it comes to climate change, because we really are far behind. So in terms of the data that we were collecting and connecting it to the economic piece, we estimated health costs from basically a range of variables here. So we're talking about the economic impact of premature mortality, what's called the value of a statistical life. That's basically a metric that EPA and other federal agencies use in regulatory impact assessments to assign economic value to premature mortality. We also used data from the Agency for Healthcare Research and Quality, AHRQ, which is part of the Centers for Disease Control and Prevention. They're tracking how much it costs to treat problems in the emergency room and hospitals. They're also tracking hospital length of stay data for people who have to, spend multiple nights in the hospital and may forego wages at work while they're dealing with responding and recovering from their health problems. But we also tried to take a little bit of a longer view. Once people are discharged from an ER or a hospital, they may have a need for ongoing care, whether it's outpatient care, someone to come to their house for physical therapy, for example. Very often, they may have to pay for prescribed medications. And so we used data from MEPS, the Medical Expenditure Panel Survey, basically to put all these puzzle pieces together to get a better understanding of the economic picture here. I mentioned this data collection project and the challenge that we faced. I collected, along with our team, about 36 data sources across these case study sets. Everything from peer-reviewed literature to public reports from state and local health departments to data collected at the federal level. It's great that we have access to all this public data, but we do need CDC to step up and modernize public health surveillance when it comes to the climate crisis. Right now, CDC in responding to the pandemic has been relying on fax machines, emailed spreadsheet attachments, and even recordable CDs to track real-time what's happening with COVID-19. That is no way to run a public health surveillance system in the United States in the year 2021. We certainly need CDC to be equipped with adequate financial resources to modernize their data systems so that they can catch up and understand what the climate crisis means for the health of Americans right now. So in terms of the health data that we actually looked at, our study shed some new light on climate-sensitive health problems. I mentioned Hurricane Sandy. We did uncover some data pointing to mental health problems that were observed in the wake of that superstorm, including anxiety and depression problems. We also uncovered information about homelessness problems, people experiencing pregnancy complications, people injured in carbon monoxide poisonings, etc. We also uncovered new information about wildfire smoke. This is increasingly receiving a lot of attention across the country. I think any of you who know people in California or were scrolling through Instagram last fall can remember those vivid orange skies. Those, looks sort of like out of a movie, right? And that smoke has been increasingly a worry because fine particles, other toxic compounds are released when these fires burn through entire towns and villages. That smoke can spread really far. NRDC has shown that the geographic region affected by wildfire smoke can be as much as 50 times larger than the area directly burned. So wildfire smoke is certainly a problem in North Carolina. It's a problem all across the East, even though a lot of the wildfire risk that we hear about in the news is happening out west, but it's certainly a problem that's affecting huge swaths of the country, including North Carolina. I also want to highlight the great climate risk assessment and resilience plan that the state published last summer. I've been combing through it and I'm really impressed by the understanding of the compounding, cascading climate risks that are emerging in North Carolina and across the Southeast. So, we're still in many ways tracking and understanding what climate change means for public health, but there is this need to alert policymakers to the real urgent need to act before we really have the best available information about all of the health problems linked to the climate crisis. Okay, so when we get to the actual health impacts here, this is our sort of key results slide when it comes to the health impact information from all the states that we collected. Across the case study set, we ended up with more than 900 deaths, 20,000 hospital admissions, and nearly 18,000 ER visits triggered by each of these climate-sensitive exposures. And remember, this just represents a sample of what was happening across the country in 2012. It's a huge burden that's really, sidelined and unacknowledged in the public mind. When we attach the economic sort of calculus to those health impacts, we end up with a giant price tag just from this case study set. About $10 billion attributed to this case study set of climate sensitive exposures, including in North Carolina, about $43 million attributed to concentrations of allergenic oak pollen that are, worsening respiratory health for people across the state. We did find that premature mortality dominates that $10 billion price tag, about 8.4 attributed to those early deaths. But the illness burden, $1.6 billion, was still significant. It was larger than we anticipated. That illness burden is a key equity finding as well. We estimated through the available health cost information that Medicare and Medicaid patients shouldered almost 2/3 of that $1.6 billion. So we're talking about $1 billion in illness treatment costs shouldered by just Medicare and Medicaid patients. Unfortunately, that finding aligns with our scientific understanding that our most vulnerable neighbors are experiencing the brunt of climate harms and the costly burden of treating those health problems. Of course, Medicare and Medicaid are funded in part by taxpayer dollars, right? So we, in some sense, are all paying for the health costs of climate change right now through higher Medicare and Medicaid premiums. So in many ways, this is a problem that is hitting disadvantaged communities the hardest, but it's one in which none of us really can escape the costs. I want to wrap up and leave enough time for Q&A, but I do want to mention a couple of challenges in conducting this study. First is the data issue, which I think I've thoroughly emphasized. Also the delays between the climate events happening and our understanding of the health effects. I'll point out this wasn't a climate change attribution study, so we weren't doing any statistical link between the extreme heat season or the allergenic pollen concentrations and climate change signals. We are just trying to set a baseline in terms of what's happening out there in order to extrapolate into the future. The models tell us that all of these problems are going to get a lot worse, so you can think of that $10 billion as just a starting price tag. That's a lot of doom and gloom, but I want to offer some hope towards the end of my talk. I'm a former EPA scientist. I work at NRDC. We last year celebrated the 50th birthday of the Clean Air Act, the landmark environmental law that has used the power of science and legal enforcement to lengthen the life of everyone in this country, to achieve more than $2 trillion in health benefits. And EPA itself estimates that the health benefits of the Clean Air Act outweigh the implementation costs by a factor of more than 30 to 1. And we certainly believe that action on the climate crisis will lead to a similar, hugely cost beneficial situation when it comes to public health. Action on the climate crisis right now, cutting climate changing pollution and preparing communities through adaptation investments can help to avoid immense suffering, save lives, and billions upon billions of dollars each year. I just want to close mentioning the situation in North Carolina. I have been talking to NRDC colleagues. I know that we're engaged in the state on multiple fronts. Increasingly, these days we are focused on RGGI, the Regional Greenhouse Gas Initiative, and trying to tell the story that climate action and clean air benefits are also huge economic benefits, and there are ways to solidly attach pretty conservative, actually, economic estimates of the health improvements that can be achieved from cutting climate pollution through programs like RGGI. Evidence from other states, demonstrates that air quality improvements when it comes to really dangerous fine particulate matter can be achieved through this program. There's a lot of new research. This is a study published just last summer by some colleagues at Columbia University, pointing to near-term benefits of this program that will also help to stabilize the climate over the long term. With that, I just want to wrap up and point you to one other paper we recently published in Health Affairs about the benefits of this valuation approach and the need to demonstrate the cost effectiveness of adaptation investments. If early warning systems, if better, preparedness is helping people to avoid health problems, then it's also saving people money. And there's a need to articulate those economic benefits and show that adaptation really makes sense from a cost perspective. I think I've gone slightly over, apologies, but I'll leave my contact information up here on the slide, and I'm very happy to take any questions based on this talk. Thank you all.
Well, thank you, Vijay. That certainly was a masterful presentation of such an important topic. And again, your dedication to this effort and the clarity that you bring to the economic impact, particularly the focus on health, is really phenomenal. So we really appreciate your being here and making this presentation. I would like to ask a question that was brought up on the Q&A. So if you don't mind, I'll read that to you so you can address it. Given the lack of belief by a large segment of the population and government, how do you envision change being made, excluding lawsuits?
That's a great question. I think there's obviously we need action on multiple fronts. Increasingly, I've been working with medical professionals, nurses, doctors, people who are on the front lines of responding to these health challenges when people come into the emergency room in an extreme heat situation or in the wake of a coastal storm. Doctors and health professionals remain, even now, some of the most trusted people in society. Of course, confidence in sort of government messaging has been waning for years, but we have been increasingly trying to, invite health professionals to join us as advocates on climate. An ounce of prevention is really going to go a long way here when it comes to cutting pollution. But yeah, we face a huge fight when it comes to, convincing people that this is an existential threat. We've heard President Biden talk about the climate crisis in a very serious way, but I think there is a need to, color in that picture, talk about what's been happening out there across the country year after year, especially in the last 5 years or so. Last year we sped through the alphabet in terms of naming hurricanes at record pace. I mean, things, no matter which way you slice it, are really out of control. And so I see, part of my job as a scientist is to try to translate all of that scary information into action and into a hopeful, vision for the future.
Thanks, Vijay. Again, I think as we've heard today, the range of comments from the front lines to the students, to the advocacy community, and so forth, all of these voices are converging.
Yeah.
As you point out, from the president and the senior members of his administration, cabinet level members that are focused on climate, certainly an inflection point that we all appreciate and support. Also, I think even this conference reflects an opportunity to converge motive and expertise and action. We heard from Danielle Kuntz earlier about the very difficult challenges in Sampson County, but even recognizing that the COVID-19 impact there appeared to be much greater. And then reflecting on that, Dr. Korshenko reported, in fact, she could measure the increased mortality from COVID-19 in these populations near these CAFOs in Sampson County. And I think that converging data, the accumulation of data that perhaps in and of themselves in a singular fashion may not be convincing, the accumulation and the presence of scientific, population, medical, and economic data, are the types of events and activities that can, push this battleship or aircraft carrier around. It's going to take these types of presentations and scientific analysis to occur. And I really appreciate your recognition of the high quality state databases here in North Carolina.
Yeah.
There's a long history of leadership in the recognition of the environment in the state, and I think there is again a cabinet level position that addresses that. So we're quite thrilled about that.
Absolutely.
So I want to finish up by just asking you this final question, which is, are there any suggestions that you might have for policy, perhaps with Medicaid or Medicare, that would make it easy to take into account the healthcare costs of climate change looking forward?
Yeah, that's a great question. We have been talking with private insurers and folks up on Capitol Hill about the exposure that these insurers, public and private, are facing when it comes to climate risks. Right now, we actually don't have every state required to report the payers of these, of the billing, basically. And so that's, job number one, is to basically fill in the map across the country, because there is significant variation when it comes to how our health systems operate when it comes to their carbon footprints. We've seen evidence in recent months that we don't have to sacrifice quality, healthcare treatment quality, for reductions in climate pollution from healthcare systems themselves. But I think more broadly, we need to integrate our healthcare and climate change discussions nationally, right? They've kind of been proceeding on separate tracks. Most Americans can't name a health problem related to climate change, even though, in many ways, in places like North Carolina, they are, front and center. So we have a lot of work to do in explaining and sort of connecting the dots here, but I am hopeful. And we've seen increasingly the Government Accountability Office identify climate risks to Medicare and Medicaid specifically. And so I think that, the momentum is building on this issue, but we've got to keep up, our advocacy.
Thanks, Vijay. Again, a very nice presentation, and again, incredibly important work, and we're looking forward to hearing more from you and your work. Let me finally sort of address the participants in the event today. I think for me, it's been a remarkable showing of interest and enthusiasm. I think the presentations and the Q&A and the potential for engagement has been remarkable. I do want to acknowledge Clean Air Carolina for really putting this together. And if you're available to make any concluding remarks for the day, I'm happy to allow you to do that in drawing today's session to a close.
Thanks so much, Kim, and thank you again, Vijay. That was a really great presentation. I took notes. I always take notes, but so good to know about your work and look forward to collaborating with you.
Thanks.
But for the folks that are still on, thank you so much for hanging in there with us today. Tomorrow we are going to focus a bit more on solutions. We have another great lineup of speakers, and we hope you'll be back at 1 p.m. tomorrow. Please do take a look in the community board under article sharing. I did share Vijay's first published article he made reference to, but there's lots of great information, and we want everybody to be sharing their own resources as well. So thank you again, and good night to you all.